Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today, I'm delighted to be joined by Nate Fox. He is the Chief Technology Officer at Ribbon Health. Nate, thanks for joining me today.
Thank you for having me, Nick. It's great to be here.
So before we start, tell us a little bit about your background, how you got to here, and some of the journey to this point, if you would.
Yes, absolutely. So for me, my background is I'm a CTO and co-founder of Ribbon Health. I guess maybe just a little bit before I founded with my business partner, Nate Maslach. I first went to school at MIT, where I majored in engineering. I worked at Microsoft for a few years in Seattle. Got very interested in startups and data problems, and I was a software engineer working on sort of projects with the C-suite at a company named Unified, which is a ad tech company in New York City. Really enjoyed kind of the startup world. Went to business school at HBS, where I met my co-founder Nate, and we kind of stumbled upon this very interesting and complex problem in healthcare that we were very passionate solving together, and we founded what eventually became Ribbon Health. That's sort of the high level.
Okay, so to help the listeners, explain as best as you can what Ribbon Health is. And if you can, share a little bit about the story of how you got there, because it sounds like this wasn't a straight line.
Yes, absolutely. I'll maybe actually I'll set the context first of like how we got to where we are, and then I can kind of explain. So I'll actually begin with the top. We're a healthcare data company, and we provide an API that enables other healthcare companies to build solutions that then enable patients to make better care decisions. Data is really messy and complex, and we offer a platform that helps deal with that challenge. And I can go into more of what that actually means, but I'll start with kind of like how we got to this point in time. So when Nate and I had met in business school, we both come in from startup backgrounds where we really enjoyed sort of the startup experience, and we really enjoyed working with each other. I was sort of the technical person who knew how to code, and Nate was on the business side who sort of knew how to build businesses and also had a very strong product background in his prior role at DataLogix before he came to HBS. And so we started working on a variety of ideas together. And the thing that got us that we really were very passionate about was actually our experience with the healthcare system. And actually, we had very complementary or sort of very opposite experiences. For Nate, my co-founder, his mom was actually bounced around the healthcare system in the Cleveland Clinic area. And this is after Nate had worked in healthcare as a consultant at McKinsey. And he sort of felt like, very empowered after working in healthcare for a few years to help his mom navigate the system, but yet had been surprised at how difficult it was in terms of her not getting to the right specialist. And so, and being in a high deductible plan, being eventually sort of paying a lot of money through the system and in a very financially straining and stressful way. Eventually to just learn that actually she had arthritis and needed to sort of do some more yoga or to sort of do stretching because she was a yoga instructor. So that was one end of a kind of very rough experience with the healthcare ecosystem and being financially straining for an individual where, that can be very painful. And then for myself, I actually have a hearing impairment, and, I grew up I was born with it. And I was born in a situation where my parents were actually very able to navigate the healthcare ecosystem to make sure that I could get access to the right kind of healthcare providers to help me with my hearing impairment. So this meant, a number of audiologists, a number of speech therapists, and other resources in the healthcare ecosystem that helped me sort of navigate and figure out how to deal with being hearing impaired, get the right equipment, get the right training, and sort of being able to sort of make sure that, de-risking learning disabilities, things like that. And so for me, because of this very positive experience, I had sort of seen what can be, but also sort of was aware that not everyone has the privilege of having new resources to navigate and sort of figure out how to use the U.S. healthcare system to get the right kind of care that you need to navigate a certain situation.
Tell us a little bit about your journey. It sounds like you had the fortune of navigating the system for your benefit well. Is that true?
Yes, absolutely. It definitely from a place of like a fortune, right? For context, my parents had moved to a school district that had a lot of support in terms of public schooling for folks that have like disabilities. And both my parents come from backgrounds where they knew people in the network for medical providers and sort of advice on how to navigate that. So yes, I had a great experience in the healthcare system, but I don't want to sort of suggest that everyone has access to that. I think, we were very lucky to have access to that.
No, and I think that's important because you by virtue of some parameters that are, for the most part, random, you're finding a pathway through something that is extraordinarily complex. And I can tell you as a physician, so you would think I would know how to navigate this system. I can tell you, hands down, that there is no instance where I feel I am empowered and enabled to get what I need quickly and effectively. So much so that I recently posted, my wearable showing my blood pressure increasing. Why? Because I was interacting with the healthcare system. The system that is supposed to keep my blood pressure low was not. So clearly a combination of two experiences that you had with your co-founder who had, the opposite with his mother. I'm curious to know some of the things that you learned and the comparisons that led you to this model that, potentially brings that expertise to bear for those individuals.
Yep, absolutely. So I think just in the context a little bit, so Nate and I were very passionate sort of trying to solve this problem and trying to bring this sort of make it more feasible for people to navigate the system. And I want to add one detail, which was, even though I was very lucky to have good outcomes in the healthcare ecosystem, it was definitely a battle of attrition to some extent, especially for my parents when I was a little kid. So, we went through various audiologists that had sort of different opinions of the best ways to help me, and, different speech therapists that had different diagnoses. And so it was kind of this iterative approach of trying to figure out and find your way, so to speak. And so we definitely had to kind of stumble in the dark to some extent, then get to a good path. Nate and I, both named Nate, we had this background where we kind of thought it should be like kayak.com, right? Like when you're navigating healthcare, you can go to kayak.com and sort of at the click of a button, you can see flights, car rentals, hotels, so forth and so on. Why couldn't something like that exist in the context of healthcare, bringing all the data together in a seamless way where it's all connected with each other and allowing a patient to sort of navigate and sort of find what they need? And so the first iteration of the company we had founded was something focused on care navigation, where we had sort of learned in like diving deeper into sort of the healthcare ecosystem that, there's been a lot of studies and things that kind of share this, but that you can actually increase the quality of care while reducing costs through better care navigation. And so we wanted to sort of make this more tech enabled and sort of and empower that to happen. And the way that we did that was we built a care navigation platform where the business model was to offer this as a service, essentially a care concierge for employees of smaller, medium-sized companies where there might be a self-insured component and actually help them navigate the care more effectively and where, we increase the quality of care while reducing the cost of it. And then, we monetize through like a benefit sort of fee. But that of course isn't the business that we end up actually building to the state that we are now. And I can kind of get into how we sort of end up stumbling upon the data problem.
Yeah. So what changed? What did you learn that sort of caused that move or shift away? I mean, it still feels, I listen to that and think, well, do I want kayak for healthcare? Oh yeah, I do. But you've moved a little bit from there. Tell us what happened.
Right. So I think one thing I want to stress is that our mission always remained the same, which is to make every health condition be cost effective, high quality, and convenient. That's the mission of the company. That hasn't changed, but really just as the how to your question, to the point of your question, that evolved. And so what happened was when we were working with our clients, the way that the first thing we learned was making it really easy to book an appointment or have someone book an appointment on your behalf made people engage with the care way more effectively. And so for a lot of the employees using our platform, this is like when we had gone through Y Combinator and we had a few hundred folks on our platform, we were navigating their care. And one of the things that we found that was a delightful experience was we said, hey, you get a free PCP appointment with your employees' healthcare. We actually found some great doctors near you. Can we book you an appointment? And then once we made it as easy click of a button, pretty much everyone would say, that sounds wonderful. Yes, book me an appointment. And so this was a service that we started doing for our end users to drive engagement and adoption of them engaging with their healthcare. And so on the back end, so the user had a delightful experience, but on the back end, Nate and I, in a HIPAA compliant way, of course, were booking appointments on behalf of these patients. someone needed to see a therapist. We would then go find them a therapist that accepted their insurance or a cardiologist or a PCP appointment. And when we were doing that, we realized just how bad the data was. And so we would say, okay, we need to find this person a cardiologist, and we would go through the directories. And we'd say, okay, this doctor changed states. This doctor is retired. This doctor is actually no longer practicing this location. This doctor is no longer accepting new patients, so forth and so on. And so our sort of hit rate, so to speak, of like saying, okay, we need to find this person care, we would be calling doctor after doctor after doctor until we eventually found a good match. And so that's when we stumbled upon the data problem. And we started aggregating and collecting data from various sources to increase our success rate at finding a doctor for patients. And what was interesting was that on our website, we had a demo page of our doctor search of like kind of displaying all the various data and the quality of it that we had. And other healthcare enterprises came to us and said, hey, less about your care navigation application or experience, but this doctor data, where are you getting it from? Do you sell that? And that kind of instigated the aha moment that maybe there was a different problem that we should be solving that might be sort of potentially more impactful to the ecosystem to potentially build a data solution for this problem that apparently a lot of healthcare companies were struggling with.
That's really interesting that you started to publish data. And I've got to understand, how did you get to it? Because a lot of this information, if it's available, it's buried somewhere, or in many instances is not. What was your strategy to get to that source of data to be able to start to pull it together into a meaningful, I'm going to diminish the value here and call it a spreadsheet. I know it's much richer than that, but
of course, no
everybody can reconcile against that.
Yeah. So one thing we pride ourselves is at Ribbon Health, at least, is that we like to be data plumbers in a sort of in this world of data, right? And what that means, honestly, is so we aggregate data from hundreds and thousands of sources, and where this comes from is quite varied, right? It could be a PDF that we have transformed into structured JSON, right? Like a PDF that's directory. It can come from a CMS, public data set that is meant to be ingested, right? The number of data sources out there is quite varied. It's a highly fragmented ecosystem. And so I would say that the first step, and I'll get into like how we use machine learning to sort of figure out what data is good versus bad, but the very first kind of step of infrastructure we built was building a machine that could handle a whole array of different types and bring all these different sources together in one central place.
Wow, that's truly amazing. I mean, I think you sort of described much of the existing problem in data sources in healthcare very eloquently. For those of you just joining, I'm Dr. Nick, the Incrementalist. Today, I'm talking to Nate Fox. He's the Chief Technology Officer at Ribbon Health and also a data plumber of healthcare data. I'm excited to meet a plumber of healthcare data because if there's one thing that's very apparent in this business and industry is without data, we can't make informed and useful decisions. You've clearly gone at this. You've created an infrastructure that starts to solve a problem that's very real, which is we can't bring it all together. You've done that. Tell us a little bit about the sort of the move now to where you are and what you're sort of offering, because it sounds like this is much more than just navigation. There's a much deeper insight. How's that unfolded?
Yep, absolutely. So once we aggregated all the different data points, there were sort of three other areas in which I think, have provided value to a lot of the people that use our data. The first is that we then use machine learning to figure out what data is good versus bad, because it's a lot of data, but most of it's noisy and not correct. We can see hundreds of locations for a single doctor easily, and hundreds, if not thousands, of phone numbers. The second thing is that we decided to have an API first approach instead of having like a traditional software front end application. And so making an API made the way that we can integrate with end users or end applications or products or companies far more adaptable and flexible and dynamic in a very sort of fragmented healthcare ecosystem where there's a lot of different ways that people make healthcare decisions. And the third thing is that we realized that as good as our models and our machine learning could get and all the data we could collect, our data will never be 100% perfect all the time. And so we made it possible in our API or in our product for our clients to actually edit the data and be empowered to change it themselves. And so that we come to the table with great data, but if we're wrong and you find that we're wrong, we're going to let you change it. And then you can contribute to the overall data asset and make it more accurate as a whole.
So let me be sure I understand that correctly. You're essentially creating a group contributed data set. So if I was a participant, I would be authorized, almost like a wiki of healthcare data. Is that true?
Directionally, absolutely, yes. I'm putting my CTO hat and being, putting this, so there's a technical nuance there a little bit, which is that when someone makes an edit, so every end user of Ribbon's data sets has their own sort of copy and instance of Ribbon data, especially because for a few reasons. One is everyone's use case is a little bit different in the way they want to use healthcare data. And so maybe the reason that someone deletes a location pertains to because, for their use case, that location for a provider isn't correct. However, that signal is still useful as to an aggregate. So we do aggregate data as a whole, but it's not that such that if you make an edit, that it's going to propagate to everyone using it. But our overall machine becomes more intelligent and sort of incorporating signal and figuring out directionally how data should be, such that eventually when we update, we do this thing called syncing, where we are constantly updating everyone's copy of Ribbon's data based on our latest knowledge and information that we have.
I think that's really important. So this is not just, hey, I see something wrong, I update it, which, we've seen some of the challenges with Wiki with people who have a different vested interest, let's put it that way.
Yes.
In what things are presented. I think what you're doing is, hey, you've got it, you can work with it, but you are taking that feedback, but then curating that feedback with some automation, it sounds like, that says, this is useful, we're going to apply that. And it also sounds like some of that learning is about the changes, because that starts to inform your whole process of data input and how you present it to your customers and clients.
Yes, absolutely. No, I think you nailed it quite a bit. That the curation, sort of, us figuring out what to do with the data, and not all data from our clients is the same, and so kind of being intelligent about how we use that data. Like, I'll give you an example. Like, on one hand, some clients are like discreetly editing what we call core Ribbon fields, right? Fields that we manage and have models around, right? Like the location of where doctor practices. And then you have other fields that clients can even create, right? So maybe a certain healthcare client, Ribbon doesn't, have a certain special regional either like designation or sort of star rating, but they had that data. And so they can put that data in their instance of the Ribbon API or the Ribbon data set so that they can use it. And we maybe we'll take it, like maybe we'll use it one day, but a lot of clients have these custom fields that they create for sort of that last mile of healthcare data that pertains to just the use case that sometimes, we don't have out of the box the direct solution because, again, healthcare is incredibly complex and nuanced. And so we build a platform to be very flexible to that end.
Interesting. So you've now created this data set that continues to grow, benefits from all the use cases and the users. So, the additional value of bringing customers on board adds additional value to everybody else that's already on the platform. So obviously you're encouraged to participate. Yep. Where is this going? And give us some examples of some of the use cases of how this is being actioned, because it sounds like this is really helping solve that problem in a way that I think is extraordinarily valuable and exciting.
Yep, absolutely. So I think like one way we think about it in terms of like where things are going, we want to continue to sort of evolve the product to make it easier to use in a variety of use cases. And we also want to kind of become a sort of connective tissue of the very fragmented data that exists out there today. So today we kind of talked about, right now we're talking about just this like, this general data that Ribbon has to start. But one way that our product offering is evolving is actually we have some data partners that we're working with where they're actually partnering with us to distribute their data to our end clients. And so we can kind of become these sort of pipes, so to speak, of the data, of making it easier and more seamless to disseminate and distribute all sorts of data. Things like, does this doctor have a telemedicine provider? Do they have a online booking that they can use? And, the sort of number of use cases, varies quite a bit. And so we really think about infrastructure and really enabling that connectivity across a variety of data types. And the other thing we think about is also making it very easy to use what we call our API. That's the thing that developers use to integrate our technology into the back end. But not everyone has a team of developers on staff to integrate our technology. And so we're exploring other ways to sort of enable people to use the Ribbon platform, where perhaps they don't have a developer to integrate the API, but they want to tap into the data and maybe have a front end that Ribbon offers to make it easy for a care navigator, let's say, to use it.
Interesting. So clearly an exciting space, lots going on, but it feels like just early part of the journey. Where are you going? What are you excited about?
So I'm incredibly excited to continue surprise. So I think the thing that the entire team at Ribbon Health, and Nate and I, the reason why we pivoted into this data platform is that we got so excited about democratizing access to this healthcare data and making it so much easier to innovate in the space. Provider data and the complexities of that is not everyone's core competency. And we want to make it more frictionless for people to sort of innovate in healthcare and worry less about this problem so they can focus on their other core competencies that they are good at focusing on. And so we get really excited about working with customers like Oak Street Health or Decent or Health Advocate and Firefly, which are a mix of very innovative healthcare companies in the space of value-based care, new health plans, care navigation, offering that in a variety of ways. And we want to help empower companies like that to innovate in new, really exciting ways to help bring better care to their end users and their patients.
Exciting stuff. So if you were to look at the year ahead, where do you think that those trends are going? What is our future hold? Because there's a part of me that's a little bit cynical and says everybody's going to say, "Whoa, no, I'm not letting." They don't want to share, because there's some anti-competitive elements to this. Clearly, where are we going?
So I think what we're seeing is so our investor from Andreessen, who's her name is Julie Yu, and she has some great sort of themes around what she kind of labels as the great unlock in digital healthcare, where in the last year or two, we're seeing an incredible explosion of innovation and activity happening, where almost to everyone's surprise, things are becoming more interconnected. People are sort of opening up sort of connections and figuring out how to navigate the complexity. And so I think what we're going to see in the coming years, much more interconnectivity across a variety of experiences and innovation happening in the space, where there's now new software that makes things that used to be incredibly complex way easier, in a way that we made the complex aspect of provider data management much more simplified via an API. And so I think when you have all of these tools, you'll have people that are so empowered to sort of innovate at a speed that we've never seen before. So I think we're going to see the speed of innovation change in this space in quite a big way.
Fantastic. What an exciting point to end on. As usual, unfortunately, we've run out of time. So just remains for me to thank you for joining me on the show, Nate. It's been a real pleasure. I'm excited to watch it. And quite frankly, I'm excited to use it and see some of this data in action, because I think we've had a paucity of data in healthcare. This seems like a real solution that's artful in the way that it goes off, grabs it, pulls it, makes it useful, and then presents it in a way that anybody can use it. Nate, thanks for joining me today.
Nick, it was an absolute pleasure. Thank you so much for your excellent questions, and really enjoyed the time with you today.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, the Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.